Let's take you back to COVID. Some breaking news for you. The government has announced that pre-departure COVID tests will be a requirement for all people travelling to the UK. Now, that is an effort to clamp down on the number of cases of the Omicron variant being brought into the country. Nigeria has also been added to the UK's red list. That makes it the 11th African country on that red list. The Health Secretary, Sajid Javid, has been setting out the details of those plans in the past few minutes.
Yeah, since we learned of this new variant, our strategy has been to buy time to assess it, but also to put in place protective measures. And we've always said that we would act swiftly should new data require it. Over the recent days, we have learned of a significant number of growing cases linked to travel with Nigeria. There are 27 cases already in England, and that's growing. And Nigeria now is second only to South Africa in terms of linked cases to Omicron. So today, the government has decided to add Nigeria to the travel red list, and that will be effective from 4 a.m. on Monday, which will mean that only UK citizens or residents of the UK can enter the UK from Nigeria from that point onwards, and they will have to quarantine in one of the relevant hotels. We have also decided to require pre-departure tests. That's for all inward travellers. That will be effective from 4 a.m. on Tuesday, and they will be required a maximum of 48 hours before the departure time. That we've been clear that we will take action if it is necessary, but it is important that whilst we are introducing these new border measures today, that to remember that vaccinations, they are our first line of defence, and the booster programme, the expansion in the booster programme is hugely important. And can I please just remind everyone, if they do get their call from the NHS when it's their turn, please do step up, roll up your sleeve and get protected.
And what's triggered the pre-departure tests being announced? Why has that change come in?
We've kept the data under review over the last week or so since we learnt about Omicron, and we're seeing increasing number of cases linked to travel. And again, we've always said we will act swiftly if we need to, if the changing data requires that, and that's why we've decided to bring in this change on pre-departure tests. Now, I will stress these are temporary measures. We want to remove them as soon as we possibly can, but before we learn more about Omicron, it is right that we have these measures in place.
And with the pre-departure tests, so Labour's called for them, Sage spoke about that being a sensible idea at the start of the week. Why the wait?
I think it's really important at a time like this to have a balanced and proportionate approach. The measures that we introduced around this time last week, which were around the PCR test, the day 2 PCR test, when everyone arrives back in the UK and self-isolating until you get a negative result, and some of the other measures around red listing countries, I think they've been the right response. But when the situation changes, if it requires more action, it's absolutely right the government acts swiftly.
So with these new measures, what does this tell us about the spread of the Omicron variant?
We've got about 130 cases that are absolute confirmed cases across the UK. That's actually in England, and across the UK, I think around 160 cases. And so it is growing, and we do expect many more cases. But at this point in time, with the interventions that we're taking, so for example, the self-isolation changes for those that come into close contact with someone that has a suspected case of Omicron, these are all helping. But we will keep all of this under review. And again, if we do need to take further action, we will.
And how many people will be affected by these new measures?
Well, it depends on how the measures may actually impact the desire to travel. Of course, it is something that's going to particularly hit people that had travel plans, and that is hugely unfortunate. But I think the vast majority of people understand exactly why it is important to take action so we can have a much less incursion of this variant into the UK.
And what about British travellers already in Nigeria?
For travellers that are already in Nigeria, they will know of this at this point, and they will have to put in place measures for the managed quarantine system, and there will be advice available for them on the UK government website.
So do we have any update on just how serious the Omicron variant might be? There's been reports that it might cause mild infection, but are there any updates on that front?
I'm afraid there's no further updates at this point. We are still working actively, both our scientists here in the UK, working with their international partners. Just yesterday, I had a call with the head of the World Health Organization, and we're working closely with all our international partners to learn what we can.
And should people be prepared to change or cancel potentially Christmas plans?
I think people should carry on with their plans, and they should make plans to enjoy Christmas as usual. The guidelines that have always been there are still there, the ones we set out a few months ago, even before this variant. Of course, we've known all along that COVID and flu, for that matter, it likes the darker, colder days that winter brings. So, just follow the guidelines that are there about, hand hygiene and having ventilation where you can, but most of all, enjoy yourselves.
So we're seeing more kind of international restrictions come in. If the situation gets worse, won't we have to bring in more domestic restrictions?
We'll keep the situation under review, as we've always said, but I think that today's action again shows that whenever the government needs to act, we will.